Good afternoon. I'd like to call this meeting to order of the,
Recording in progress.
good afternoon. I'd like to call the meeting to order of the District Board of Health on Thursday, June 25th of 2026 at 1 p.m. I'd like to call a roll call, please, at this time.
Vice Chair Andriola.
Present.
Board Member Driscoll.
Here.
Board Member Anderson is absent. Board Member Brown.
Here.
Dr. Danko.
Here.
Dr. Duarte.
Here.
Chair Reese is absent, but we do have a quorum.
Thank you so much. If we could, Mr. Duplantis, would you lead us in the pledge, please?
Of the United States of America and to the republic which stands one nation under God, indivisible, with liberty and justice for all.
Thank you. We'll move now to public comment.
Comments heard under this item will be limited to 3 minutes per person and may pertain to matters both on and off the board agenda. Unused time may not be allocated to other speakers. The board may also hear public comment under individual action items with comment limited to 3 minutes per person. Comments are to be made to the board as a whole, and virtual public comment may be taken when facilities are available. We did not receive any requests for public comment in person or online.
Thank you. We'll go ahead then and close item 3, move to item 4, approval of the agenda. I'll entertain a motion. We have a motion by Member Driscoll, a second by Mr. Brown. Any further discussion? Hearing none, all those in favor signify by saying aye.
Aye.
Any opposed? Motion carries unanimously. Thank you so much. We'll move now, or I guess it's on your screen too. We'll confirm it with. All right. We'll move now to item 5, recognitions. Ms. Dixon.
Wonderful. I have the honor of acknowledging 2 recent retirements. And so I would like to start with many thanks to Ms. Cindy Hawks for her 26 years of service. She has provided invaluable support to our entire disease investigation team, particularly in the areas of hepatitis, animal bites, respiratory disease, just to name a few. And then with a few more years, we have Ms. Sunita Monga with 30 years of service with our WIC team. She is a registered dietitian who had significant impact on the lives of pregnant women and young children in our community. In addition to running a WIC clinic, she provided services primarily to high-risk clients, including medically fragile newborns. And we are grateful that both of them had the opportunity to work here at NNPH, and we wish them the best. And then for Health Heroes, Ms. Frenchie Rubio is going to open.
Hello, for the record, Francesca Rubio from EHS. In the month of May, we had 10 Health Hero awardees, each being recognized for going above and beyond their normal job duties, demonstrating teamwork and commitment to serving our community. The first one, we have Felisa Hilliard from ODHO, Raquel Grafton from PhD, Kelsey Zaski from PhD, April Miller from PhD, Stephen Shipman from PhD, Anastasia Ganawan from PhD, Andrea Esp from PhD, Brandon Koyama from AQM, Candace Brown from AQM, and Steve Fisher from AHS. Thank you to all our May Health Heroes for the positive impact you make every day. Thank you.
Thank you. Anything else, Ms.
That's it.
Dixon?
Thank you.
Well, congratulations to everyone, but that's a lot of institutional knowledge that's leaving.
It's a lot.
So I hope they've shared as much as they possibly can and they're not moving in case someone has to talk to them. All right, thank you so much. Congratulations to everyone. We'll move now to item 6. It's a consent item agenda. It's 6A through 6G. If anyone has anything they'd like to pull or any additional information. If not, I'll entertain a motion at this time. Okay, do we have a second?
Second.
Do we need public comment on this?
The agenda is set up for public comment at the beginning and the end,
Okay.
but you are welcome to invite public comment on any action item. if you'd like.
Well, just for sake of following through with that recommendation, at least for consideration, do we have any public comment?
We do not.
All right, we have a motion by Member Driscoll, a second by Member Brown. Any further discussion? Hearing none, all those in favor signify by saying aye.
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 Any opposed? Motion carries unanimously. Thank you very, very much. We'll move now to item 7, which is a recommendation to accept the Remsa Health Monthly Franchise Report for May 2026, which include Remsa Health accounts, receivable summary, compliance by zones, average response times, and more as outlined on the agenda. Welcome, Mr. Duplantis, and thank you for doing the pledge. Appreciate it.
Thank you. It's been my pleasure. My name is Barry Duplantis, Chief Executive Officer and President of Remsa for the record. For my report today, I'd like to provide you with an update of Remsa's ground franchise performance. I understand you've been provided with a copy of Remsa Health's May 2026 report. In May, we responded to 8,945 EMS calls. That's an all-time high. So I just want to accentuate a topic that we've mentioned a bit before, and it's that our community continues to grow. And fortunately, our systems are designed to grow with it and provide the community with the coverage that it needs. We transported 5,813 patients to area hospitals. Our average response times for Priority 1 calls were in the area of Reno, 5 minutes and 32 seconds on average, Sparks, 6 minutes, 12 seconds on average, and Washoe County, 8 minutes, 27 seconds on average. I'd also like to report on the Priority 2 calls, our average response times. In the case of City of Reno, 7 minutes and 5 seconds. Sparks, 7 minutes, 48 seconds. Washoe County, 9 minutes, 35 seconds. With response to our responses, we are fully compliant with all of the franchise terms and conditions with regard to Priority 1 calls. We give significant attention to the quickness of our responses, which is very, very important to the community. But there's a point that I actually want to highlight, which I think is very special and says a lot about our community, and is that care begins when the person dials 911, because that is the precious part of which initiates a timely response to someone in need. Our community is very good at picking up the phone and doing their part. And in coordination with our dispatch center, we start providing care with that person who has dialed 911. So I bring that up because that's just the person who makes the call is where care begins. And that is something that I think is precious in this day and age where folks like to pretend they didn't see anything. And the fact that people engage and care for one another, because really, when you start looking at emergency health care, it's folks caring for people. I mean, that's the common denominator there. With regard to fire dispatch with the Truckee Meadows Fire Protection District, I'm proud and excited to tell you today that Remsa and Truckee Meadows Fire Protection District agreed to a 1-year extension for Remsa to continue to provide fire dispatch for Truckee Meadows Fire Protection District. The other thing I will comment on that is that Chief Edwards and I have already met because here we are in the middle of fire season once again. And it's very critical that we work together to make sure that our agencies are supporting each other because we just don't know what it's going to look like, but we do know it's been a dry year and there's been a propensity from fires, from lightning strikes, et cetera. Similarly, Yesterday, I met with the City of Reno Assistant City Manager, the Fire Chief, and union representatives to talk about coordination and opportunities for response improvement. Fiscal status of REMSA. REMSA, as I've mentioned before, is a 501c3 not-for-profit organization and only charges when patients are transported to area hospitals. That said, we certainly take a very keen fiscal approach to what we do, and in the spirit of the community growing, as I just told you about the record number of responses, we have ambulances ordered for the next year and a half. So I just want you to know, as stewards of the community, that we are ordering equipment well in advance of the day of need, because as you know from all of the things that you're involved in, you just don't pick up the phone and say, I need an ambulance tomorrow, or a fire truck tomorrow, or a police car tomorrow, and have it at your disposal. Lead time is long. So we've got orders extending out now to a year and a half, and we're actually looking at extending that because there's no doubt that our community is growing very strong. With regard to our customer survey results, and I wish Dr. John Novak were here to participate in this discussion, quite candidly, because he always asked me about our patient care surveys. In the month of May, our number was 94.41. Our highest score was the degree for which the medics took your problem seriously. The one thing I will share with you is that for years, we've been frustrated with the lack of number of people that participate in the survey. I mean, for example, out of the 5,000 responses we do, we get like maybe 131. That's like maybe 1%. It's very small. Moving forward, however, I'm very pleased to tell you that we've worked with the district health officer and his office, and we have a new EMS survey company that we are bringing on board, one for which will provide the District Board of Health with real-time, complete transparency into the results. And essentially, the way that this is going to work is that each of the people that we transport are going to receive a phone call from the EMS survey folks within 10 days of the service being provided to get their overall patient satisfaction response. So the feedback is going to be real time. District Board of Health is going to have complete clarity in real time, transparency in terms of what the responses are. And I will also say that the service that we have selected, the Baldridge Company, is a company that is used by many other world-class EMS agencies around the nation, such as the Richmond Ambulance Authority, EMS in Tulsa, Oklahoma, and Sunstar Paramedics in the Pinellas County. That's the Tampa region. And they're all very pleased with the service. So I'm hoping that we will see similar results and have more, be able to capture more customer feedback. Next, with regard to fire regionalization, just to bring you up to speed, because I don't know, exactly, where your current knowledge is on that. The next activity that's going to take place is a workshop scheduled for July the 21st. And while REMSA is not a contract party to the regionalization study, REMSA has been very amenable and participatory in providing any and all information that has been asked of us to support the regionalization effort. So July the 21st will be the next meeting of the contract parties, and I will candidly tell you, I will be there to participate and support the effort. Lastly, meet and confer. We have completed our meetings with regard to meet and confer. I think we had about 19 items that were on the list of items to consider. And I believe that item is going to be presented for discussion at the next District Board of Health meeting. Having said those things, I'm happy to answer any and all questions that you may have with regard to my report today.
Thank you. Does anyone have any questions? Dr. Danko, I'll go to you first. Do you have any questions?
No questions for me. Thank you so much.
Thank you. Anybody here on the floor? Well, thank you so much. Keep up the great work. All right. we're going to go ahead and close item 7, move to item 8, presentation and recommendation to accept the Washoe County, Nevada Air Quality Trends Report. Yes.
I believe we have to accept the report.
Yes, it's an action item.
Oh,
I'll
thanks.
accept the report as presented.
Well, look at that. That was a test. You guys all passed. So we have a motion. Who made the motion? Motion by Member Brown, second by Member Driscoll. Any further discussion? All those in favor signify by saying aye.
Aye.
Any opposed? Motion carries unanimously. This is what happens when you write notes on top of for possible action, just so you know. If you saw my paper, there's all over. Thank you. All right. We're going to now close item 7 officially and move to item 8, presentation and recommendation to accept the Washoe County, Nevada Air Quality Trends Report for 2016 through 2025.
Cool. All right. Good afternoon, Chairman, members of the board. My name is Ben McMullen, Air Quality Specialist with NNPH Air Quality Management Division, here to present the 2016 to 2025 Washoe County Air Quality Trends Report. There's a clicker right here. I'm like looking for it. No, you're good. Okay. So to provide some background to the report, we must understand what our air quality data is compared to. Clean Air Act requires the US EPA to establish the national ambient air quality standards. These 6 pollutants are ozone, particulate matter, nitrogen dioxide, carbon monoxide, sulfur dioxide, and lead. AQMD monitors 5 of those 6 every hour of every day. These pollutants were chosen by US EPA due to their documented risk to public health and environmental health. The annual Air Quality Trends Report has been published every year since 1989 and is formally a requirement of AQMD's federally approved Quality Assurance Project Plan. The report summarizes ambient air quality data for the past year and for the last 10 years in Washoe County. So there's Air Quality Index monthly summary for 2025. And in 2025, AQMD recorded a total of 2 days at unhealthy for sensitive groups AQI or higher. Both of those days were attributed to ground level ozone pollution in the summer months. And on July 10th, 2025, smoke from the Green Fire contributed to the unhealthy for sensitive groups AQI recorded on the same day. And here's a 10-year AQI trend in Washoe County. The 10-year AQI trend for Washoe County details significant variability from year to year due to significant wildfire impacts in 2018, 2020, 2021, and 2022. The area's historically poor air quality in the wintertime continues to improve as our rules require old wood-burning devices to be replaced with more efficient new devices. This shifts our air quality concerns to the summertime. In the summertime, we continue to see uncontrollable pollutant emissions from wildfires in the west, but also experience unhealthy ground level ozone pollution. Ground level ozone is formed when oxides of nitrogen, volatile organic compounds, sunlight, and heat react. These pollutants are commonly emitted by sources such as motor vehicles, industrial facilities, chemical solvents like paints and oils, and gasoline vapors. One of our largest sources of these emissions comes from motor vehicles. Small voluntary actions can be taken to reduce these emissions, including supporting electric vehicle adoption, reducing vehicle miles traveled, planning development to include urban heat island mitigation, and reducing energy consumption. Going further on that, reducing ground level ozone is critical in the area. The ozone NAAQS may be revised in the coming years in a range from 60 to 70 parts per billion. If strengthened, it may lead to a non-attainment area for ozone in Washoe County. A non-attainment decision by the US EPA leads to restrictions on local industry, local development, and the general public. Future development for the area should consider voluntary measures to reduce ground level ozone, like road diets, transportation-oriented development, promoting active transportation options, promoting public transportation, and promoting carpooling to reduce vehicle miles traveled. It's important to note that any increase in capacity on our roadways will induce further growth and increase traffic in the long run. Vehicle miles traveled and traffic are reduced in the long run by reducing vehicle capacity and promoting alternative forms of transportation. So takeaways from the trends report are that our air quality concerns continue to shift from wintertime to the summertime. Increasing vehicle miles traveled are a major contributor to ground level ozone, and that air quality data and the air quality trends report are valuable resources when it comes to air quality planning decisions. And with that, open it up to any questions, comments.
Thank you for your overview, Mr. McMullen.
Sure.
Does anybody have any questions? Mr. Driscoll?
Thank you. Thanks for the presentation.
Yeah.
Question on the monitoring stations.
Sure.
Since we're continuing to expand our population base within the various valleys that we currently look at, are we going to need to expand our monitoring?
So currently we meet EPA's requirements for monitoring, but we did just open up a monitoring station in Verdi that monitors for particulate matter, ozone, and all meteorological parameters. But beyond Verdi, we don't have further plans to expand the monitoring network. I'm sure you guys know that it cost a lot to open Verdi, so costs are a concern there. But yeah, in the long run, if it comes up.
Thanks. I was just trying to plug Verdi.
Yeah, I like it.
Any other questions? Thank you so much for your presentation.
Yeah.
And this is an actionable item, so I'll entertain a motion at this time.
I'll make the motion. Oh, second, Rika Danko.
Did you make the motion?
Dr.
Okay, I couldn't hear. Dr. Warte made the motion and the second by Dr. Danko. So we have a doctor motion and a doctor second. Any further discussion? Hearing none, all those in favor signify by saying aye.
Aye.
Any opposition? Hearing none, the motion carries unanimously. Thank you so much. Thanks for your presentation. It was great. We'll move now to item 9, review, discussion, and direction to staff regarding the provisions of the interlocal agreement entered into by the cities of Reno and Sparks and Washoe County for the creation of the Health District. So I think we're going to have Ms. Reed, please.
Thank you. Dania Reed, Deputy District Attorney. For the record, as you know, yearly I've been requested by the Health District to introduce this item, Section 7C of the interlocal agreement that was originally entered by and between Washoe County, Reno, and Sparks in 1972 and subsequently amended 3 times, does require that this board have an opportunity once a year to express any requested changes to the interlocal agreement or to confirm the agreement as it currently exists. If the board has questions about any provisions or concerns, it may raise them and discuss them at this meeting. Then the board can either direct staff to bring any recommendations to the 3 jurisdictions for their consideration, which has generally occurred at a concurrent meeting, or they can approve the interlocal agreement in its current form, and it will move forward in that form until next year. Any potential amendments, should the board request, must be made before October 1st of this year. The interlocal agreement specifically requires that those amendments be made 90 days prior to the agreement's renewal date, which is January 1st. It automatically rolls over from year to year. So with that introduction, if the board has any questions or provisions that they would like to discuss among one another or explore, make recommendations to staff, I will open it up.
Great, thank you. Anybody have any? Yes, Mr. Driscoll.
Question on process.
Sure.
We just discussed that if we as a board were doing something, that the October timeframe is a critical date.
Yes.
And then that rolls to another date specific where things would be perfected.
Right.
If there were operational changes in the valley and that one or more of the partners to the ILA brought something forward that needed consideration of this board, is there a way to, I know we can have a conversation,
Right.
but is there a way that if it was deemed to be important, that it could be modified mid-term, or would it have to wait for the October timeframe and the regular annual cycle?
That is a question I have not been asked. So in an effort to not stall, the agreement specifically provides that the agreement may be amended by mutual consent of the parties not later than 90 days before its annual renewal date. So that seems to me to be a pretty strict deadline. I think if there were a critical issue that would affect the governance of this board in regard to something that might happen outside of that timeframe, we could discuss that. But here's what I think. There's a brief period of time, right, between October 1st and when the agreement rolls over in January. On January 2nd, this board could probably begin discussing any type of amendment for that applicable year, because it still would fall 90 days within that deadline, 90 days before. So I think it's actually a very large window of time. It's probably a very smaller window when arguably there would be a prohibition on doing that for the existing year. Does that explanation make sense?
I'm comfortable with that
Okay,
explanation. Thank you very
great.
much.
Any other questions? This is an actionable item, so I'll entertain a motion at this time.
Madam Vice Chair, so moved.
Okay, we have a motion by Member Driscoll. Do we have a second by Member Brown? Any further discussion? Hearing none, all those in favor signify by saying aye.
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 Any opposed? Motion carries unanimously. Thank you so much. We'll move now to item 10, staff reports, and I'll turn it over to Ms. Dixon maybe to introduce each one. Do you mind?
Absolutely. no
Great,
problem.
thanks.
So the first division is air quality management with Mr. Francisco Vega.
Thank you, Chair, members of the board. For the record, Francisco Vega, Director of the Air Quality Management Division. One of the things that I did put in my report for this month was a response to a question that was brought up during last month's meeting by Dr. Duarte. And it essentially was, I guess, clarification on some of the data regarding ozone that was in the American Lung Association report. Specifically, there was a couple sets of years in which the data was low. And I think in my statement last month, one of the periods is 2009 and 2011. I think I assumed at that part that it was due to the economic downturn and the kind of recession at that time, and that was accurate. There's actually EPA reports that cited that due to reduced economic activity, there was an improvement in air quality. The other period of time was 2022 to 2024, and the information associated with that data was a reduction in wildfires. So we saw some of the wildfires from 2020, 2021, and then 2022. That data kind of started to drop off, and so that's why we started to see the improvements in air quality. So that's a little bit of an explanation behind some of those data points.
Thank you.
Yeah, of course. I also included in my report some recent legislation at the federal level. Within the House of Representatives, there was a legislation passed that is proposing to provide a waiver for ethanol fuels up to 15% to be approved to be used essentially all year round. Right now, how that process works is essentially states and EPA can issue short-term waivers, which is pretty common. And we've seen those already this year, a handful of those waivers, but they only typically last, I think, 20 to 30 days. So they have to continuously issue these 20 to 30 day waivers. So with this legislation, essentially, it would just allow for the sale of E85, which is fuel with 15% ethanol, to be sold year round. So wanted an update on that because there was some questions from the board as well from the previous month. So at this point, the legislation has only passed the House of Representatives, so it does have to go to the Senate and then go to committee and then go to the president. So it still has a ways to go before it does become a law at this point. But I did want to update the board on that. Let's see. In the month of May, we did have one exceedance of ozone, but no exceedances of PM10. And again, more recently, as we saw in the trends report, I think we had a couple of exceedances last year. Exceedances of the ozone standard are becoming, I guess, more common during the summer months. So we'll keep track of those. You heard during the trends report presentation some of the things that impact ozone pollution. We obviously track those as well. And that's pretty much all I have to say about that. Let's see. As it pertains to plan review, I'm happy to report in the month of May, we did process 100% of the plan review applications in a timely manner. And on a year total, we are at 99%. So happy to report that. And that concludes my update. Happy to answer any questions.
Thank you, Mr. Vega. Thanks for the follow-up, too, with the questions from the previous month.
Yeah.
Appreciate that.
Of course.
Any questions for Mr. Vega? Yes.
Just a comment. Thank you very much for your follow-up and the information. And your reports are always excellent, but I appreciated the review of the chemistry of the air pollution that was available in this month's reports.
You're welcome.
Thank you.
Of course.
Thank you, Mr. Vega.
Thank you.
All right, we'll go ahead and move to item 10B. Ms. Dixon.
Absolutely. Community and Clinical Health Services, Ms. Christina Shepard.
Good afternoon, members of the board. Christina Shepard, Division Director for Community and Clinical Health Services. A couple items that I wanted to highlight from my report this month. We featured the changes to the WIC food packages this month. This is the largest update to the WIC food packages in more than a decade. And the new packages offer greater choice, more culturally diverse foods, and a stronger nutritional balance for our participants. We've had really good feedback from our participants thus far. They especially like the increased fruit and vegetable benefits, the whole food options for infants, and then the expanded dairy and protein substitutions. Our WIC staff has also done a really great job supporting families through these changes with individualized counseling and then helping them use the digital tools like the WIC Shopper app. A couple other program notes. Our immunization team has completed its annual Vaccines for Children compliance activities for this fiscal year and has shifted planning towards next fiscal year. And then they are gearing up for the back to school season. So our biggest back to school event will be August 8th here at the campus, where we try to vaccinate all those kiddos so they can start school on time on that Monday. Our family planning sexual health program has begun offering a patient-collected cervical cancer screening option for eligible clients. This allows individuals, particularly survivors of sexual abuse or assault, to complete screening without the need for a pelvic exam, so it increases access to this valuable screening tool. And then our community health workers were very active in May with outreach events, and notably they participated in a Harvey Milk Day outreach event where participants were offered free STI screening. This event targeted the unhoused population and the LGBTQ plus population, which historically has been hard to access and is underserved. Happy to answer any questions you have.
Thank you. I just have a quick question. To the last event you just spoke about, approximately how many people did you see?
We saw 33 people.
How many?
33.
33. Thank you. Open. Miss Dr. Huarte.
I noted an increase in the number of people that the WIC program is serving, about 5%, if my calculations are correct.
Yes.
Do you think this is the beginning of a trend, or do you think this is a sporadic event that we're seeing?
It looks like numbers have gradually been increasing month over month. So I think it is a trend that we're seeing. Okay. We have been doing a pretty active outreach campaign to increase our participation numbers over the past month. But because we have seen the increase month over month, I would say it's a trend that we're seeing versus our activities in the past month to increase the participation rate.
Thank you very much.
Any other questions?
Thank you.
Thank you so much. We'll now move to item 10C.
Wonderful. Mr. Rob Fida with Environmental Health Services.
Good afternoon, Board. Robert Fida for the record, Environmental Health Services Director. My report is in front of you. There's a couple things I did want to highlight. So staff are continuing an investigation into a salmonella outbreak. I believe it is concluded at this point, so I probably should have more for you next month. The other thing I did want to highlight is some of the unpermitted vendor work that our staff has been doing. I added some photos of some of these setups. They're seeming to get more robust, I guess is the best way of putting it. We're seeing a lot of folks, I think, from out of state coming in and doing these pop-up setups and stuff like that. And you can kind of see they're taking over street corners and stuff like that and leaving behind kind of a mess. So this is I believe, an issue that will have to be tackled sooner or later. Staff are doing their best with the tools we have. However, a lot of this is done jointly through with partners because a lot of this work tends to be at odd hours. There is an unsafe element here as well. And so we've been working with our regional partners to kind of do, I guess the best way of putting it is a little strike forces, essentially. Take these complaints, try and assess and hit the most common spots. And the other thing I did want to highlight is some of our team. May is our busy month for pools, and the team did 262 inspections for pools in the month of May. So a lot of hard work went into that. Staff have, I think, gotten through, I guess, the initial wave, so hopefully they'll get a little bit of reprieve in the coming months. And then our PFAS grant sampling. So we did our first set of homeowner well sampling. We've had a pilot program scheduled for a few staff that are on wells as an educational opportunity for staff participating in the grant program, and as well as kind of getting our system in place. So the next couple of months, you'll be probably seeing more, we'll be getting more results from some of that PFAS sampling, and we'll see how that looks. Staff are looking to target about 60 samples a month until funding runs out, so we'll see from there. And then the other thing I think that will be of interest is our staff finalized a contract with KTMB and the county manager's office, and this is for a rapid response cleanup of kind of public land sites. They're putting together a small team to kind of go and monitor certain sites that they know are prone for dumping. So this is going to be through KTMB in partnership with the county manager's office. So our staff, and I know the county manager's staff, are kind of interested to see what we can do to help and improve some of that dumping and maybe divert resources away from some of these sites potentially. So those are kind of the big key highlights I wanted to bring up. I'm open to any questions.
Thank you so much. I'm just going to start with a couple questions, and I'd like to just share with the board a couple things to your point on the KTMB partnership, but also what's coming down from a Washoe County perspective. I think the board would like to understand how you're going to be involved. But my two questions are directly related to the unpermitted vendor. So thanks for providing that information. How are you discovering this? Is it just organic, or how are you learning about this?
A lot of it is complaint driven. We get a lot of restaurateurs and property owners. They're setting up on their sites, and either they have to clean up after this, or they're competing with permitted businesses, and a lot of times they'll set up something like that. And it's usually outside their jurisdiction. So a lot of this is complaint driven is what it is.
So is there, and obviously the folks that are playing by the rules are being impacted because they're playing by the rules. And so I'm just wondering, to my second point, is there a messaging, or is there a phone number, or is the community aware as well? I realize that there could be complaint driven that's just from whoever the property owner is that doesn't have the authority, that unpermitted vendor doesn't have the authority, that can be driven that way or in other aspects. But is there a certain number that you call if that occurs?
Staff have been working on actually an app that we're developing, the food truck app, and we're hoping that can be used to mark unpermitted vendors in real time. That way we can track them, because I think a lot of it is also timeliness. When these complaints do come in, it's usually next day and the vendors are gone. So we're developing an app for food truck owners, one as advertisement and two as real-time reporting potentially. So once that is up and running, I think we're in the stages of finalizing that app. We'll probably do a press release to kind of push that out to the community and to some of those business owners as well.
Yeah, that would be awesome. What do you think the time frame is? Just curious. I'm not trying to put you on the spot. You could say within a year. That would be really broad, or, I'm not trying to put you on the spot. I'm just curious.
I was gonna say, we've gotten, I think, right now, I think we're in the kind of the troubleshooting phase, that
Okay.
we're gonna run it, I would say probably in a fall, winter area. We're looking probably for a full rollout and of totally functional.
Okay.
So,
Thank you. I just would like to share to Mr. Fida's point about the KTMB cleanup and the dumping and what have you. Washoe County just recently unanimously passed an ordinance that gives the district attorney the ability, and legal and law enforcement the ability to go on sites, go on to actual homeowner, if you will, parcels that have been taken over, I'm using my terms, that have been occupied, I'll do it a different way, have been occupied without any authorization. And because there's a loophole, or at least we close the loophole, that directly impacts the fact that if somebody is a property owner and is deceased, and there isn't any easy method to find the next legally responsible owner of that property, the way that everything has been written prevented, and that's a good thing. You don't want the authority for somebody to come on your property if it's your property. But if the owner is not around to actually give the authorization to occupy that property, then what do? Law enforcement can't go, other officials, health can't go. And I will tell you, if you want to see something that you would be surprised, there are several of these parcels, and most of them are in Sun Valley. And I have ridden with the Washoe County Sheriff's Hope team many times, and you would be surprised. In many cases, we are talking 30 to 40 to 50 people on a parcel being occupied with health implications. I'll do it that way, with major hazardous health implications. And so you're in that neighborhood, and that's what you're seeing and impacting. So one of the questions I had at the commission meeting was, what is going to be engaged for health? Because you guys have to be directly impacted in terms of helping. You're going to have to help on that. I don't know what the time frame is on that, but get some rest. Get some rest. It makes the unpermitted vendors look. That's a serious problem, by the way. I'm not making light of it, but this has been going on for years and years and years. And so happily, the Board of County Commissioners, honestly close that loop. And it's going to take time. I don't even know how long it's going to take to clean some of those properties. So Ms. Dixon, you're shaking your head because you know what I'm talking about.
Absolutely.
Let alone the health impacts.
We are more than happy to help. The team does address always complaints, and I think we're more than willing to partner with the county and see where we can, align resources and best leverage everything. So
It's going to take a huge amount of community support for that. Thank you. Any questions? Yeah, Mr. Brown.
I just want to say, Robert, thank you to you and your staff. Looking at the commercial plans and development reviews, numbers are great. 100% in May, and then 96% over the entire year. To see those numbers come up from past years, it really shows you're doing a good job out there. So thanks for getting that done.
I'll let the team know. They've been working hard. So.
Yeah.
Thank you. Any other questions? Dr. Danko, do you have anything?
No, thank you.
Thank you so much. Thank you for all your hard work.
Yeah, thank you.
Okay, we'll go ahead and move to item 10D. Ms. Dixon.
Wonderful. I'd like to invite down Ms. Dr. Nancy Dow from the Director of Population Health.
Good afternoon. For the record, Nancy Dow, Division Director of Population Health. We have been in our exercise season in the late spring and early summer as usual. So our preparedness team has coordinated several exercises from April to June, and this included support to planning and coordination efforts in the local hospitals to test our medical response surge requirements during the Reno Tahoe Airport exercise on May 13th. That happened, and a team also facilitated a workshop, then functional exercise for the hazardous material exercise on May 27th, which was focusing on response operations during a cyanide spill. But most recently, this month on June 4th, our preparedness team also conducted a tabletop exercise for our internal leadership and designated staff at NMPH, just focusing on NMPH's ability to maintain mission essential functions in the event of a disaster. So the scenario that we played for our exercise was a ransomware cyber attack that encrypted all our critical systems, causing widespread shutdowns for NMPH websites, phones, and online systems, requiring activation of our continuity of operations plan. And all our internal divisions participated and were asked to identify and prioritize core functions, as well as evaluate our ability to manage non-essential functions during an activation. I would also like to bring to attention to the National Certified in Disease Intervention Certification exam that took place for the first time in April of this year across the United States. A majority of our public health investigators, some epidemiologists, fellows, and supervisors took advantage of this opportunity and sat through the exam and became the very first group nationally to be certified in disease intervention. That's a big deal. And this exam was.
Hold on, that's a big deal.
That's a huge deal.
That is a big deal. The first round.
We're the first group nationally to be certified.
Nationally, that's like a big deal. Thank you.
Yeah, this
Sorry to
exam
interrupt.
was developed through a national workshop of disease intervention staff, and our own sexual health epidemiologists also participated in the development of the exam and study materials. And the administration of the exam and certification was conducted by the National Board of Public Health Examiners. So congratulations again to all those who sat through this 3-hour exam and received this official certification. Yeah.
Again, congratulations.
Very, very proud. And finally, just to note that with the continued Ebola Bundibugyo outbreak that's happening right now in the DRC and Uganda, our epidemiology team is continuing our efforts to monitor travelers from the DRC, South Sudan, and Uganda. And to date, there has been no cases that's been confirmed in the U.S. That's all my updates. I'm happy to answer any questions.
Thank you so much. Do we have any questions for Dr. Dow? Thank you so much, and a big congratulations. Did you have a question? Okay, so that clap was not, and I don't think even rateable. It was not even rateable. So really, congratulations, please, everybody. That is amazing. That is amazing. Congratulations. I hope that gets messaged out as well.
We're
I'm
working
sure,
with the comms team, for sure. Yes,
Yeah.
thank you.
Mr. Driscoll.
Question, are we doing some kind of media information regarding this wonderful
That's what I just said.
accomplishment?
So absolutely, I believe that Dr. Dow just mentioned that our comms team is going to be working on messaging,
Yeah.
getting
The
that.
messaging is coming
Yes, thank you.
with a big
just make
clap.
that happen.
Thank you.
Thank you.
Thank you so much. All right, we'll move now to item 10E. Ms. Dixon.
All right, and before you have the Office of the District Health Officer report. There is a lot of information in here, including information from comms, our administration team, and our outreach, a number of our outreach activities. I'd like to focus on 2 thank yous for staff. First of all, for our admin team who are wrapping up the fiscal end of year, while the rest of us are starting to enjoy summer, this is a really tough time of year for them. And I just want to say thank you for all their extra hard work as we are rapidly approaching the July 1st date. It is a team effort with all of our program managers and supervisors, but huge kudos to that team and the amount of work that they're doing. And then I also want to say thank you to our staff in advance. We are gearing up for an office remodel, and I am grateful in advance for all the staff support and their patience and their adaptability, as remodels are never easy, but the end result is going to be very nice. For the first time in, I think, 25 years, we're going to be looking at even just replacing the carpet. So we're looking at, thank you to the team in advance. So that's it.
awesome. Well, great. Any questions for Ms. Dixon? Well, you'll have to put what the remodel will look like when it's done. That'll
Yes.
be the incentive to
incentive.
just, as you're pushing through, because it's never easy. And thanks for always including the media mentions. That's really, really helpful as well. All right, we're going to close that item and move to public comment. Do we have any public comment?
Comments heard under this item will be limited to 3 minutes per person and may pertain to matters both on and off the board agenda. Unused time may not be allocated to other speakers. The board may also hear public comment under individual action items with comment limited to 3 minutes per person. Comments are to be made to the board as a whole, and virtual public comment may be taken when facilities are available. We have not received any requests for public comments.
Thank you so much. All right, we'll move now to item 12, board comments. Any board comments? I am going to do a huge shout out to two folks from Northern Nevada Public Health. I put together a working group. Washoe County has been looking at, for the last several years, modifying and updating equine ordinances that haven't been looked at in over 20 years plus. And I say to people, what was it like when you were here, if you were here 20 years ago, to where we're at now, to Mr. Duplantis, always sharing that we are growing, growing, growing. And so I put together a group. We had legislators there. We had representatives from various organizations, again, including Northern Nevada Public Health, to speak to what things were outside of Washoe County's jurisdictional authority that could be looked at. It was a really, really great meeting. I heard feedback that a lot of various agencies, everyone's so good at what they do, but they may not realize what others are kind of doing. And so it was a very good informational meeting, so that if there is either administrative through NEC, regulatory, a process that could be considered, and/or legislation that may be considered in the upcoming legislative session in 2027 that'll soon be here. But I really wanted to give the two representatives that were there from Northern Nevada Public Health not only spending the time, it was a long meeting, but really offering clarity as well from not only the folks that were there, but also from various jurisdictional agencies that is really helpful. So I guess I should say that we are going to have a follow-up with Northern Nevada Public Health and those representatives, because there was some additional information that came out of it that I think can be helpful for those that choose to enjoy being in the equine business, not only in the community, but throughout the state. So it's been a very interesting conversation that all happy to entertain. If anybody wants to know all the details, I'm happy to talk about it. In the meantime, hearing no other further board comments, we're going to call this meeting adjourned at 1:53. Thank you so much.